if you learn the way things are supposed to work and just follow the directions of what they put in there, I have to evaluate some local grants too. I haven't been involved with any national, what do they call them, study sections, but I've done a lot with grants, local grants given out by Maine Medical Center and a couple other of our institutions in Maine. And you do see people who just don't follow the directions. You write it down on a piece of paper in black and white. You do this, and this is what we want to see, and people don't do it. And so the very least you can do is just kind of read what they tell you to do and follow that.
Really just read through the application or the opportunity announcement thoroughly. Really get a good sense of what they're actually looking for. Some opportunity announcements are pretty obvious. They will spell out specifically what they want applicants to propose. But there are a lot of times where you receive an opportunity announcement that's pretty open-ended, and it's up to you to propose activities, but really know what they're asking for, what they're looking for when they aren't as obvious about it. So it's really important to take a few times to just really read through, absorb the announcement, make notes, and then start to formulate what you might apply for.
I would say that the first thing that I learned was that it's really important to get to know your funder and to have a good sense of the types of projects your funder is interested in giving money for and supporting. When you see an RFP, if you're not sure it's a good match, you can always call. There's always a contact person, and it's a good idea to use that number, call the person, and find out if what you're envisioning for a project is actually going to be something that the funder's interested in. And most of the time they're pretty honest and will tell you, oh yeah, that sounds like something that would fit in our portfolio, or no, that's not anything we would be remotely interested in. And you can save yourself a lot of time and headache if you know what types of projects the funder you're seeking is willing to pay for. I would say that in addition to the funding issue and knowing the funder, that it is definitely a really good idea to follow the instructions, read the instructions carefully. Along the same lines, I cannot emphasize how important it is to read the directions, the instructions of the grant very, very carefully. Make sure you know exactly how many pages you have at what font and inch margins, etc. And that's something it's best not to just entirely entrust to yourself. Grant writing is best if you have a team, and particularly if you have some people who are, big thinkers, writers, who can get the vision of what you're trying to put down on paper out there, and having somebody who is really, really detail oriented that can create quality assurance checklists of how many pages you have for each section. And definitely partnerships. You need a quality assurance process of some sort.
I think it's important also for, and sometimes difficult, but I think still important, that you get feedback or criticism from local people and your peers, and that can be hard to do because people don't want to offend you. You write something up and you give it to somebody, and you say, "What do you think?" And they're trying to be nice to you and say, "Oh, it looks great." That doesn't really help you very much. So you need people who are tough enough to tell you to your face, "I didn't understand this," or "You really got to do this differently," or "You spelled this word wrong," or whatever it is, without causing offense at a personal level with people that you have to interact with every day. And finding people who will do that for you, because it takes time to do it well, is difficult. And I have to say, I never really found anybody to do that for me. But when I am asked to do it, I try to do that as honestly as possible, trying not to insult the person individually, You know, so I still think you're a good person. I still think you're smart, but you know, here's what I think you know needs to be changed about this document that you're going to submit, or here's what I think they will think when they read this, and that's hard to do on both sides because you don't want to offend people or turn people off. And when you're the recipient of that criticism, you have to get past the initial feeling of being personally insulted or whatever, because you know somebody's trying to help you and it's difficult for them, and so that can be one of the toughest things, but it's really necessary to do. It's a lot easier when you're anonymous, and like I review things for journals and articles that are submitted, as well as grant applications, as I said, locally here. And it's easier if they don't know exactly who's saying these comments, and if they can be anonymous and hopefully objective. So looking for ways to get that kind of feedback on what you write, I think is an important thing to put into the mix in how you develop your application.
I think when it comes to grant writing, never underestimate the importance of your being a good English student. And really, I think sometimes, a lot of times when you're in public health or in certain fields and you're going through school, you don't necessarily think certain courses pertain to what you ultimately think you'll be doing in the real world. But I can't stress enough how important it is to have just a solid foundation of good writing skills, good reading comprehension, to really contribute to grant writing success.
I would say that the most important thing is to make your grant proposal easy for the reviewers to follow. So that includes things like clear and direct writing. Don't write in passive voice. Don't take 100 words when 50 words will do. Be as clear and direct as you possibly can. And also use headers, use outline format, if that makes sense for the proposal, to give your reviewers a roadmap so that they can follow what you're trying to do really easily. Having been a reviewer for federal grants, I know that if it's really a lot of work to figure out what somebody wants to do, then it's hard to give them a really good score for that, even though the project itself may have a lot of merit. If they haven't done a good job explaining it, then that can be really challenging. And relating to that, one of the things that I find effective is to always think of the grant proposal as narrative in some way. I mean, it's almost like a heuristic. We're all wired to understand stories of decline or fall, or the victim and the hero. And so if you think about that when you're writing your grant proposal, you want to explain, in sort of vivid language that's going to grab the reader why your problem that you're trying to solve is so heartrending, or why this health disparity really needs to be addressed, and the hero is your project or your program and how you're going to solve it.
It's very helpful to demonstrate that you know what you're talking about. And most of the things that I submitted as grant applications, including the ones I got as well as the ones I didn't get, I could at least say, well, look, I'm a doctor working in this area. I know what these people look like, at least at an individual level, and maybe I'm not the expert on the statistics or the data of national databases, but I at least know what it means to have this kind of an injury or that kind of an injury. And I think that gives some credibility. I think also it's helpful if people kind of know who you are, or at least can know the organizations that you're associated with or where you're coming from, so that if they've kind of vaguely heard of you through groups that you're part of, and I was part of some professional groups in surgery as well as the American Public Health Association. So there's reason to think whoever was doing the evaluation might have at least, bumped into me or heard of me, and so I might have some credibility that I'm not just some total person out of left field who they don't have any confidence in. Along those lines, being able to point to some previous publications that I had in the field, I think was helpful. So as I said before, I was at least halfway through my career before I submitted any grants. Not everybody can afford that luxury, I guess, but I wasn't idle before submitting the grants. I'd written a bunch of papers and published them without any funding other than departmental funding and my own salary as a clinician. So I could at least point to those things, and maybe they weren't earth-shattering articles or worthy of an external grant, but at least I had a track record that I could sort of say, not only do I have clinical experience in this area, not only have I been involved with these organizations, but I have published before, and I can write, and when you think about it, the people that have the money or are entrusted with taxpayer money or foundation money or wherever the organization is, they want to know if they fund you as opposed to somebody else, that they're going to get a result, because somebody's looking over their shoulder too, whether it's the congressman or whether it's the organization that's providing the money. They don't want to have you give a grant and it just sort of, gets frittered away and nothing comes of it. They want to see some publications come out of it. They want to see results that are useful, so that they look good, that they spent that money wisely and chose wisely who to give the money to. So you got to convince people that you're a good bet, that if they fund you, they should have reason to think that something's going to come out of that, and that you're not going to fritter it away and produce nothing, because then nobody wins. And so I think having a track record and having some credibility in the field that you're addressing, I think is essential to the whole thing.
What's I found to be really important, particularly with applying for US CDC funding, is demonstrating past successes in areas that they're looking for. So in the case with the cancer programs, a lot of the applications that we receive, they really want you to be building upon previous program activities. So it's really important for us to sit down and think about what have we as a program accomplished that we can continue and put out there to the US CDC to demonstrate that we have capacity in this area, we have proven success in implementing these activities, and this is why we should keep receiving funding for that activity. So I think those are two really key points that we tend to focus on, or I tend to focus on, when preparing grant applications. A lot of public health careers are really founded on grant writing. I can't think of a time I've worked in public health where my position has not been grant funded. So it's really critical, I think, and I wish I had done this sooner, to seek out opportunities to learn about the grant writing process and to work on grant writing prior to even perhaps entering the field. If you have opportunities within school or within a part-time job, or even as soon as you graduate, your first job, really seek out those opportunities to try to get those skills going as soon as you can. I think that's one thing I wish I could have done sooner and had done sooner. It's been very much trial by fire.